Good afternoon, everybody, and welcome to today's Evolution Medtech Query Builder webinar. Just a few little points to start with. You should all be able to see my screen. Now, in yesterday's webinar, a few people said that they weren't able to see certain parts of the screen because it was too small. You do have a zoom option. If you look at the top of your screen, beside where it says now viewing Medtech Global screen, you should see a zoom and there's a little drop down button beside it where you can zoom in as you wish. I can't see the same screen that you're seeing, so I'm doing this blind. Somebody sent me these instructions yesterday. This will work as long as you're not in full screen mode. If you are in full screen mode, there is a button on your side panel. It looks like two little overlapping documents. This will enable you to zoom in as well. So hopefully you'll be able to see everything clearly. My name's Caroline Birkinshaw and I'm part of the Medtech training team. We've got you all on mute because there are an awful lot of, certainly we've got 31 people online at the moment and 96 people registered. So there may be more of you listening in under a single registration. So we've put you all on mute so that because we can't cope with lots of people talking at the same time, the sound gets degraded. We have a question session at the end of this webinar. We've allowed a half an hour question session. So please type your questions in at the end of the webinar in the question box, and we will answer them as we see them. Now, some people may have specific queries that you are struggling with to build. We may not have time to cover these types of questions in the short time that we have for the question session. So what I'm asking people to do is to send those queries in to us, and we will look at them and come back to you and deal with them. If you just put the information into the question, the GoToWebinar will give us your email address and your name, so we'll be able to contact you. If you'd prefer us to phone you, then just put your phone number in there as well, or just type in "contact me please" and your phone number, and we'll get back to you and discuss any specific queries that you're having or challenges that you're having with your queries. Because this session today is targeted for people who have had no experience whatsoever in building a query, have never looked at it at all. People who have some experience in query building, but like a little bit more confidence in what they're doing. And we should have some tips and tricks which should be beneficial to some of the more advanced users. We are looking at running an advanced query builder session at another time. But this one is more around the basics of how to build queries. So it's looking at the concepts of query building rather than looking at individual queries that people might want to build. So getting started, what I wanted to show you first of all is just a quick dip into the Insight customer portal, where you will find the user manual. So if you go into downloads on the Insight portal and to the Evolution training guides and manuals, everything that we cover today will be covered in the user guide. So you will be able to download this and use it in conjunction with the webinar. The webinar is going to be just moving bits and pieces out of the way so I can scroll down. The webinar will be put into the Insight resources, so I'll show you where that's going to be as well. And you, hopefully by tonight, that will be uploaded onto Insight. So here we have the Medtech Evolution Query Builder user guide. So it's under the heading of Medtech Evolution, General Practice Specialty Module Guides. So you can download the Query Builder document onto your system, and you can print it off or use it online, whichever you like. So if I just go back one step, the webinar you will find under the Evolution Resources. Sorry, no, beg your pardon. I put you wrong there. The webinar will be found under the Evolution Webinars. So it will be in this section here. So you can come into here and we will upload the webinar into this area here. So there's also, if you weren't aware of the fact that there are some webinars already in here, ones we've done in the past, which are always available to you whenever you want to have a look at them. So that just covers that little bit of housekeeping off. In Medtech, for those of you who've used Medtech 32, you may be aware that in the Medtech 32 resources, we have a whole suite of test Query Builder templates that you can download into your system. We don't have those currently for Evolution, but they are in progress. So very shortly, within the next few weeks, we will have the whole suite of query builders set up in the Evolution resources for you to download. So you'll be able to just pop into there, into downloads and Evolution resources. And in this section here, you will see the suite of Evolution webinars, the same as they are in the Medtech 32 section. So hopefully they will be useful for you, so that if you're not used to query building, you can download these queries and play around with them, use them as test queries. They're not going to do you any harm, and nobody's going to get upset if you change them. Right. So covered that, so we'll go back into here. So where is the Query Builder in Evolution? So it's a good place to start, and you'll find the Query Builder in the Tools ribbon on Evolution. So pop in here, and the Query Builder icon is this one here. You can right click on it and add it to your quick access toolbar, and then you've got it in here. Now if you come across your Tools ribbon and you do not have the icon in here for the Query Builder, it's because you do not have access. That's something that can be dealt with internally within your own practice. Go and talk to whoever manages your Evolution database and who looks after the setup and the access rights for people, and discuss that with them, and they can make that available to you if it's appropriate. So we can open up the Query Builder. And if you've not had a look at this before and you are a Medtech 32 previous user, you'll notice that it does look very similar to the Medtech 32 Query Builder, and a lot of it works exactly the same. So you can carry on using the queries that you used in the same way that you used them in Medtech 32. And if you've recently converted from Medtech 32 to Evolution, all of your queries will have come across into the query store in Evolution. So you'll find exactly the same queries that you had in Medtech 32. So what are all these boxes about, and what do they do, and how do they function? So we're going to have a look at what they do. Obviously the name, you give your query a name. You have to give it, especially if you want to save it. You would need to give your query a name so you can find it again. Underneath that, we have a selection called tables. So that's this area here. And in the box underneath, there are various tables that you can pull information into your query from. So all databases are built on tables. So looking at this, we have a patient table, invoices, things to do with finance tables. We have measurements, which is to do with screening, immunizations, recalls. Most of them are self-explanatory as to what the tables are about. So being able to know where the data is stored in Evolution that you're looking for in your query is pretty imperative to being able to build queries. So you need to know where things are. Otherwise, you will choose the wrong table and you're not going to get the information that you expect. So within these tables, we click on the little plus sign besides one of these tables. You've got some more options in here, and these are called fields. So you can, within the table, you have many fields, and this is the patient table. If we look at immunizations, you've got fields within the immunization table, and so on and so forth. Prescriptions. We've got tables within fields within the tables. So to explain some of these fields to you, the patient table is a very easy option to use to explain these to you. If I bring up, let's just bring up a patient. Second, Mr. Test. And if we go to the F3 screen, to Mr. Test's patient register, all the fields that are in the patient register are represented in the patient table on here. Do I have to open that up again? Okay, so I need to close the screen before I can open this up. So every single table that is in the patient register is represented, oops, now I've got it stuck, is represented on the patient F3 screen. So if I just close that for a second and come back into the query. So in the patient table, we have the name, we have account balance and date of last invoice, addresses, dates of birth, country of origin, enrollment information, highest health card, insurance, and so on and so forth. So looking down here, you will recognize that all of those fields are represented in the F3 screen. Likewise, for screening, all the fields under measurements are all represented in the screening terms within Medtech Evolution. So coming back to the patient table, what we're going to do is build a very simple query just from the patient table to start with. So by making sure my cursor is in the table section, I can choose, say, registered patients. So one of the advantages is if you are an ex-Medtech 32 user is you can, as long as you've got your cursor in this box, you can type the name of the field that you're looking for rather than having to scroll all the way through that list, which you do have to do in Medtech 32. So we're going to look at registered patients. So what I've done is I've put that field into my where box. And the where box is where you ask the question. What is it I'm looking for? What do I want to ask the query build for? So this is the question that you're going to ask. So I'm starting off here by asking the query builder to find me all my registered patients. So you'll see here that it says that the condition is undefined. And that's because if you think about the registered field in the patient register, there's a drop-down box. And inside that drop-down box are options, and those are called values. So if I double-click on the registered field, or I can click on the C here and open this up. And you can see here that the values are represented by the same values as are in the registered field on the patient register. So if I select registered, then that will give me patients who equal the value of registered. But what if I want to do a query that includes registered and another value besides registered? Would I need to run two queries? And the answer to that is no, because you can change the condition. So instead of choosing equal, which is the default condition, you can open this up and choose, for instance, in. So when I choose in as my condition, I can select registered, but I can also select casual as well, or any other option that I choose. If I change the condition again to not in, that's the flip side of my chosen values. So it will select all the patients who are not casual and who are not registered. So it would select these patients: deceased, not registered, other IPA, transferred, and visitor. If I chose is blank, then it would select all the patients whose registration status is blank. Now, this one wouldn't work in this particular query because you cannot have a blank registration status. It's one of the fields that in the program where there is always something in there. So if you're adding a new patient, there will always be a default registered status in there, and you cannot leave it blank. But if I was searching for the date of birth or ethnicity, those fields can be left blank. So this would give me the option of finding all the patients who have a blank ethnicity or a blank date of birth. But this won't work for registered patients. And the last one in this selection is I could choose all the patients where the value is not blank. If I chose that option, it would give me, my query result would give me registered, casual, deceased, transferred, the other registered status, all of them. So I could select everything. In this instance, I'm going to select equal and equal to registered and OK. I'm going to go back into my patient table. And we're going to do a fairly straightforward, simple query right now. So I'm going to select surname and put that into my output or my select box. Oops. Right here. Because I want to find all the names of my registered patients. So I don't need to put any further information into the top box because I'm just going to look at patients who are registered. But I'm going in the bottom box is what you would select for your output. So what do I want to know about my registered patients? Do I want to know their name? Do I want to know their date of birth, their NHI number, their address? So all of those fields can go into the output box, in the select in the bottom. So I could find date of birth and put their age in. I could find ethnicity and put their their first ethnicity description in. I could put their street address in. Oops. Oops, I've gone a bit peculiar here. Up in their address, street address is what I was looking for, and their city. So these are the types of entries that you would put into the select box, whatever you want to see as a result of the query builder finding the patients that you've put in the top. Somebody has sent a hi, so I'll ignore it. And then we'll run that query. If you've added a field in here that you don't want any longer, that's what these arrows on the side will help you with, and both in the top boxes and the bottom boxes. If I didn't want the street address after all, I can use these arrows to remove the fields from my selected boxes. Likewise, I can also move them up and down. So if I would like the ethnicity above the patient, age, then I can move them to where I want them to be. You'll notice that I've chosen surname and first name over full name. That's a personal choice. I think I prefer to have the surname and first name because the full name gives you the full name including the title. And so all my patients that I bring up in my query, if I use the full name, will be listed by title. So it will be Mr. Test Patient or Mrs. Test Patient. And by choosing surname means that I can select my list alphabetically by ticking this box in the bottom here. So output that, and my list will show up as an alphabetical list. So when I run the query, and this is how you get the result to display from the question that you've asked. So I can run this query and I've got an alphabetical list of all the patients in my database, which, because it's a dummy database, there aren't very many. It's given me their ethnicity code or their ethnicity description, which was the first ethnicity on the patient register, and it's given me their age. So that's a very, very simple, easy query that you can run. Now that's given me a list of patients' names. So this is called a list query. If I didn't want to know who they were, but I wanted to know how many there were, I can take these fields out and I can include what's called the count function. And the count function is the very last table in your list of tables. It's over here. And I can pop that into the box instead. And this will allow the query to be counted. So it will count all my registered patients. So I run this query and I have 11 patients. The tabs that you have along here, you have the designer view, which is where you build your query. You have your data sheet view, which is where you see the result of your query, and you have the audit history. So it will tell you who has run various queries over a period of time. So you can see Dr. Brown, who I'm logged in as, has done quite a lot of querying today. So I was getting ready for this webinar earlier. But you do have a full audit history on who's been running queries and which queries they've been running. Now, if I add into my query at this point, a couple more fields. So I'm going to add in an age range. This field here, pop that in here. And then I'm going to also add in gender. It could be something else, it doesn't matter. It could be ethnicity. So now when I run this query, I get a couple more tabs along here. One is called a spreadsheet view and one is called a chart view. So when I click on the spreadsheet view, it will break my query up into age bracket. It's the same as the data sheet view has done, but it will put them in a nice neat table for me, and it will also count them. So whilst I can see quite clearly that I have 11 patients, if you're looking at a database that has thousands, you're not going to be able to add those up in your head if you come in here and go 1, 2, 5, 7, and so on. So by using the spreadsheet view, it will count it up for you. So you get a total of the number of patients that you have. I have 8 female, 3 male. You'll also get a chart view. And so by clicking on the chart view of your query, you can see you get a really nice table colored. So if you've got a color printer, you can print this off in color, so it will look really nice and neat. So, and again, it gives me the same information in a graph view. I can change this graph to a pie chart. I can change it to a stacked version option. And I can switch around. So when I went in the designer view, I ordered this query by date range first and gender second. But when I'm in the chart view, I can simply reverse that around and order it in the opposite line. So this is something that, again, skips past a lot of people, and not everybody knows that these options are within the query builder. So, but I think they're really neat choices to have. Well, the one trick that you need to know when you want to do a spreadsheet view or you want to do a chart view is that you can only have 2 outputs plus the count function in your output. And they do need to be fairly tightly numerical. If I put, for instance, if I take the date of birth, age, range out and replace it with the date of birth, age, you will see that the column, there's too many columns and it will not run the query, because it's going to be, if I've got 1,000 patients, it will give me 1,000 ages, and therefore I will have 1,000 columns. So that won't work. So you do need to keep your selection fairly tight. If I choose ethnicity code, for instance, and use this one for my, whoops, what happened there? Not sure. Change that around that way. No. Okay, I apologize for that. That shouldn't have happened. But what that would give me is many more columns on my spreadsheet view. And so it will make it more difficult to run or to view. Okay, so that's looked at a few list queries, or a list query as opposed to a count query. And now we're going to have a look at the query stores, or these options along here. How do I save a query? How do I rename a query? How do I save it for another time? So we'll pop into the query store, and this is a list of the queries that I have available at the moment. So when you've run a query, and it's a good one, you certainly do not want it to disappear and never to be seen again. So we're going to save it into the query store. So the first thing we need to do is give it a name. So and we're going to save it as, and we're going to put it into, oops, we're going to put, this is my mouse causes that problem. So if I use my trackpad, I don't get that error. We're going to save it in here. So I've given it a name, so we can save it in this list. And it's now saved. So when we go back into the query store, we will now see that query there, and it can be brought up and used as many times as you like. And it can be changed and adjusted. If I want to run a brand new query, I can click on New Query, and it will take the old one out and start again. When you're in the query store, you can delete old queries. So you have a delete option here. And it's a really good opportunity, or an option, to delete queries that are no longer required, or somebody's been playing with some queries and they save them, but they don't work, they don't give you any valuable information. And so the query list here can grow very, very long and get very unwieldy. Most of you will have probably, I say, if you've moved over from Medtech 32 to Evolution, usually take the opportunity when you're going through that exercise to tidy up your list of queries. But if you didn't do that, a simple trick that I have passed on to many practices is that if you send a message round to everybody to say you're going to delete some of the queries in the query builder, and they're all looking like this, if you ask people to put their initials beside their own queries, so I can bring this query up and I can put my initials beside it, and then save it. Then say after a couple of weeks, you can then let everybody know that all the queries that do not have anyone's initials beside them will be deemed to be old queries that nobody's interested in anymore, and then it's much easier to go through and simply highlight those ones and delete them. Saves you having to open them up, test them, check them against the other queries. So I don't know if that's a good tip that you'll find useful, but you're very welcome to it anyway. Importing and exporting queries. So if you have a really good query that you've built and the practice down the road gets wind of it, you can send them that query. It's very easy to send people queries and to receive them. If your PHO has built a query and they want everyone in the PHO to use the same query, then they can send you that query by email, and you can import the query directly into your query builder. So to do that, you can go into have a query open, go to export your query, and it's this one here that I had open, and you can see that the query type is called a .qbu file. So you can choose somewhere to save that to. So I can save that onto my desktop and save it. No, I don't want to save that. I want to save this one. Okay, so the reason it's not saving is because I have a / in here. So I just need to take that out and then it will save it. That's a general Windows issue. So that's now been saved onto my desktop. So if we have a quick look there, there it is here. So I can add that as an attachment to an email and send that out to somebody. So you can say, look, this is a really good query. Here it is. Now you can have a go. To import a query, so if somebody sends you one, they'll send it to you as an attachment. So you can save that attachment somewhere where you'll find it, either on your desktop or in a folder somewhere. And you can import the query. And here it is here. No, that's a Medtech 32 query. Here it is here, and so all I need to do is click open, and that will import my query into my query store, and then I can use that query the same as I can any other query that I've built. So being able to send and receive queries between practices, Medtech 32 queries will not work on Evolution, and Evolution queries will not work on Medtech 32. So you can only send them between like PMS systems. So there's a few tips and tricks there. These boxes you have here, obviously we've looked at the run query. So that's where once you've built your query, you run it and you can see the data that you have got from it. You've got a box, so run an SMS query. So we'll look at running SMS queries shortly. So that's the special run option for if you're wanting to send an SMS text out from a group that you've pulled up through a query. View the SQL. So this is something you don't need to worry about, but if you're interested in knowing what it is and why it's there, if you've been to university and you have studied sequential query language, which is what SQL stands for, sequential query language, you will know what this means. But most people who have been to med school and nursing school and practice manager school aren't usually versed in sequential query language, but that's not always the case. So when you're building a query, you're building it in English, which is why you use these fields and you pull them through. if you were a database administrator or a data analyst or somebody that did understand sequential query, then this is the query that you've built in that language. And so they can see how it was built. And so you can view how it is in its own language. But otherwise, you don't need to worry about it at all. Just completely ignore it. So one of the queries that we're going to have a look at next is counting queries for classifications. So I know this is a very problematical query for many practices when you're trying to count how many patients have a particular classification. So if I just bring that query up that I prepared earlier, diabetes count. So this is one where we would count the number of diabetic patients. So we've used the field in the top box, we've used the field for registered patients, so find all registered patients. If you were not interested in just your registered patients, but you're interested in every patient that you had in your database, there's another field that you can use, another field in the table that you can use. So if I take that one out and come over here and look for patient is one. We put this one into the top box, into the question, find all patients. So this will find all the people in your database where on the patient register there is a tick that says patient is one. Because you have two tick boxes, one that says patient and one that says account holder. And so it will ignore all the F3 entries that have only got a tick in account holder and not a tick in the patient is one. So that means you can easily pick up all the patients in your database. Patients whose classification is not blank. Because I'm using a dummy database, I don't have a particular date range that I'm looking for, and because some of my data is quite old, I'm going to choose to use every single classification, whatever the date might be. If you're using it, you might choose between two dates. So you can choose between two individual dates, a year's worth perhaps. You could choose from a date. So that might be all the patients who have been classified from 5 years ago, 10 years ago, 20 years ago, last month. You could also choose two, which will give you the same result as is not blank. So it will be everybody up until, if I've chosen today, it will be everybody who has a classification, who's ever had a classification entered into the database. If I choose everybody entered up until last month, then it would miss out the entries, obviously, that have been made between that date and now. Okay, so we'll go back to is not blank. And I've chosen a classification read code. So close the patient table and open the classifications. I've chosen the read code field from here and pop that in. And then the condition I've chosen is within diabetes mellitus. Now you've got, again, you've got some options here where the condition is. So when you choose within, particularly when you're looking at classifications, it will pick up the classification that you've chosen, in this case C10, and it will include any classifications that are also below that branch. And by that I mean, let's cancel that, just let's go back into evolution. This patient here, if I go to his F6 screen and into classifications, When I put in a new classification, for instance, and I come here, if I right click on that classification, which is, you can see the top of this branch of classifications is C0. Underneath, the next classification in that branch is C1. The next one is C10. If I go down a level, these are the options that are within that level, and they've all got 3 digits in their code. If I right click on any of those and go down another level, then they come down into 4 digits. I think that's probably about so that's about the bottom of that branch. So you can see that read codes are built in branches where the code starts at a very small number, and those numbers increase as you move down the branch. So some doctors are very specific in how they code diagnoses. So they may not just want to put everybody under a code of C10, which is a very broad code. They might want to be more specific, but you want to capture those codes at the same time as capturing your diabetes, all your diabetes patients. So that's why we would use within, because by using within, it will pick up C10 plus any code within that branch below C10. If I had chosen equal to, it will only pick up C10 and nothing else. So you would decide which one you would want. Right, so now I'm going to count how many diabetic patients I've got, or I think I'm going to count how many diabetic patients I've got. So I run this query, it tells me I've got 9. If I come back and add in the names of those patients, just to double check, in the first name, and you could add their date of birth and NHI number just to make sure, and run that query again, you will see that in fact I only have 1, 2, 3, 4, 5 patients who have diabetes, because the count occurrence has counted the number of encounters where diabetes has been used. So if we look at, we add into this query the description and the code and run that now, you will see that my patients have had 2 instances where an encounter for this particular code, C10-2, has been used. This patient has had 2 instances where diabetes mellitus has been used as an encounter. And again, to explain what an encounter is, we come back into here. If a code, so that this patient has got diabetes, he's got diabetes mellitus with hypo something or another, and he's also got, he has had diabetes in pregnancy as well, which is clever. So that's why it has shown up 3 times. So if you code the patients with multiple diagnoses within the same branch, they will be counted each time. Also, if you use classifications to assign to a consultation, they will also be counted as an encounter. So if I wanted to write some notes up on this patient today about their diabetes, I could select a classification and assign this classification to this consultation. And it comes in here. Now, more and more practices are doing this, and more doctors and nurses are using this option. It splits, when patients come with a shopping list of issues they want to discuss with the doctor, it allows the consultations to be split up into sections, and each section being headed up with a specific classification. So then when you come to run your query on how many patients have got diabetes, it will include all of these encounters. So you will get many more numbers when you simply run a counter-currents query than you have actual patients that got diabetes. The way around this is to make sure you've got the counter-currents included, because that will add up the number of times that the actual classification has been used, and so they won't duplicate it quite so much. And your other option then is to export your query into a Excel spreadsheet. You can then use the whistles and bells and the count functions in Excel to actually count and remove the duplicates as well. It's very easy to remove duplicates from Excel, and you can use the count function then to count exactly how many patients you have got with diabetes. I understand that for some of the nurses, this is maybe you don't have Excel, or you're not very familiar with Excel. But if you can overcome that, then you will then find you can get very, very quick and easy counts of your patients with certain classifications. Once you save this onto your desktop, it will save the file as an Excel file. So you don't have to do any manipulation within to make the data open up in Excel. It will simply open up straight into Excel as long as you have access to that program. So hopefully that's given you a little bit of insight into those types of queries. Now, another addition to query building in Evolution is you can do and or queries. Now, I'm having a little bit of technical issues with my and queries, so I'm looking into that, but hopefully we'll have that resolved, and I will put the instructions for the and queries and the or queries into the user manual. So for now, I'm going to use just give you a couple of examples of or queries that can be used. This cannot be done in Medtech 32. So I did one earlier. So in this case, it's a very similar query to the one we've just done, but I've put in here equal to diabetes and equal to asthma. So I'm going to be looking for patients that are equal to who have diabetes and also have asthma. You can use any classifications, it doesn't matter which. When I've so I'm using the same classification read code, and I've entered it twice in here. So once you've entered it twice and you've chosen in this case, I've put equal to rather than within. Doesn't matter, you can still use within. So I've chosen equal to diabetes and equal to asthma. If I then right click on the first one, I can choose and or. So in this case, I've chosen or. So I want patients who have, I want all the patients that have diabetes or asthma. When I run this query, you can see I've now got patients who've got diabetes, who have got asthma. So this patient, Fred Green, has got both asthma and diabetes. And these other patients have got a variation. Some have got asthma, some have got diabetes, some of them have got both. So that's an enhancement on the query builder from Medtech 32. And as I said, I will sort out the and query. So it's patients who have diabetes and asthma. And just at the moment, it doesn't seem to be playing ball with me, but we'll get that sorted. On the data sheet view, it doesn't matter, I'll just go back and pull in a simple query that I've done. Use this one here. Okay, so when we run a query, we've also got some buttons along here. So we have print, so you can obviously, it's fairly straightforward. So make sure you've got your correct printer set up in here and you can print your query off. Export it into an Excel spreadsheet. So I've just covered that. So I could click on here and that was what would export it, save it onto your desktop and then open it up in Excel. And then we've got Merge and SMS and we've got a little arrow pointing upwards and they're grayed out. So that's not much use to you. Now to get those boxes, those 3 boxes to activate, we need a particular field in our output and it's called ID for merge. So it's in the patient table and ID and it's called this one here, ID for merge. And it doesn't really do anything specific except make those boxes active. You can use it for any query, it doesn't matter whether it's there or not. But when it is there, and when you run it, you will get these boxes open up. So the merge field, the merge box, will allow you to add a mail merge to your query. So you've brought up a group of patients and you want to send them a document. So when you click on mail merge, you can add in here the document that you've chosen to from your outbox templates. So you do have to set up your outbox template first. Once you've selected the template that you want to use, you can decide whether or not you want to add a copy of that document to the patient's outbox. And when you click OK, a letter will print out for all of those patients that are in your query. Also in here, you can patient's visit. So this is a task for your patient's visit. So it will be a patient-only task. So it's not going to be assigned to a specific provider. It will simply go into the patient tasks. When a provider next sees the patient, they'll see a red task that needs to be dealt with, and this is what it will be. You can add a recall and an alert. So alert is exactly the same. You can just click on alerts and add an alert to your group of patients, which can be quite useful. And the other one is a recall, which I just mentioned the recall one because it is a little bit trickier. So if I select a recall and choose a recall code, so I will have set up my, my screening term prior to this. So I'm going to add a recall for these patients. So say it's a blood pressure recall that I want to send to all these patients in my query. I can assign it to a provider and I can put a date that I want the recall to start, or I could choose to spread it over a period of time. So it might be, say, a month, and I can choose to spread that recall over a longer period of time so they don't all end up on the same date. And then I can update any existing blood pressure recalls. Now, when you're doing this, it is advisable that you really do know what you're doing. Because you can cause a bit of chaos if you're not sure. So sometimes it's best to get it double checked with someone else before you overwrite existing recalls. But other than that, that's exactly what it will do. Okay, so that's what the merge option does. And then we have, the other one was the SMS. So the SMS box will light up slightly differently. So I've got a query in here called SMS query. So in this case is when I want to send a text message to all my patients. So when you're doing a text query, you will need to include patient's cell phone is not blank. So you don't want the query to pick up patients who do not have a cell phone in their F3 screen. And it's advisable, although it's not compulsory, to include no SMS is not ticked, because in your F3 screen, you've got a little tick box field that's where the patients can choose if they do not want to have any text messages sent to them. And if that's ticked, you want to exclude those patients, even if they have a mobile phone in their mobile phone field, you don't want to include them in your query. And in this case, I've just chosen patient is one. So you can add any other criteria to this. So you want to send all those patients a text message that have a recall for something, or a classification of something, or an overdue or an outstanding balance on their account. So you can choose those fields from the tables over on the right. Sorry, the left. Then in the bottom, these two fields are a must. You must have the ID for Merge, and you must have their cell phone number or their cell phone. Then instead of clicking on Run the Query, you would run the SMS query. And this will give me their ID for Merge and their cell phone number. Then I can come in, now you will see that the SMS button is alight. And I can come in here and I can compose a message to send to my patients. So I've got a template here. I can use a template, or I can choose not to use a template, and I can type them all a message. And I can set up a reminder as the same as you can for any other text message that you're sending, and go OK. And all those patients that are in that query will receive that particular text message, as long as their cell phones are still valid. So that's how you do that. And the last tick box in this area here is the up arrow. So anyone in your query, you can put them on the palette, as long as the ID for Merge is in your query. So if the ID for Merge is not there, so if I take that out of my query, whoops, I take it out, take out the ID for Merge. It doesn't matter if it's an SMS. I mean, if I come in and look at this one here, which is not a text query, this does not have the ID for Merge in it. So when I run it, that arrow is grayed out. If I pop it in and run the query, then that is now active, and my queries become a dynamic, what's called a dynamic query. And so I can select any of these patients and pop them up on the palette, which is again quite useful when you're wanting a bit more information about why did that patient end up in my query. I didn't expect them to. Okay, so I think that covers pretty much what I wanted to cover with you today. So as I said, we haven't gone through specific queries, because there's a million trillion different queries that people could be expecting that we would go through. So it's very hard to choose specific ones. But as I said earlier, we will get a library of evolution queries available for you to download within the next few weeks. And if you did want some help with some specific queries that you're running, please contact trainingnz@medtechglobal.com. So I'll say that again, trainingnz@medtechglobal.com. Or in the questions section, you could just type in, please contact me, and add your phone number. Your email will already be available to us. The email that you registered with GoToWebinar will already be available in the report that we can pull from that. So you don't need to include that. So now I will open up the session for questions. And we have with us a couple more panelists who can help with questions. Our product manager, Chrissy Patterson, and Seema, who is in our Australian team. So please fire any questions ahead that you would like, and we'll see what we can do to answer them. Let's pull that out. So I have a question here. When doing an SMS query, oops, do we have to select? No, you don't. Not in Evolution, no. You only need to do that in Medtech 32. So you don't have to select, they are all automatically selected in Evolution. So it's a little step that you don't have to take, which you did have to do in 32. I'm just bear with me a second. I'm just trying to expand my box here. Just choosing not to. Oh, I can barely see your questions, but I'm just. There we go. Sorry, I'm just having a wee bit of problem with viewing your questions. Please bear with me a second. No. We cannot import a query using data from a spreadsheet. We cannot import a query using data from a spreadsheet. For example, if we want to use data from another source, like we want to find contact details in Medtech. Can I have a think about this? I'm not actually quite sure what you can't, definitely cannot import information into data into a query. No, you can't do that from a spreadsheet. Absolutely, sorry. So you're using another source, but you want to find the contact details for those people who would be in Medtech Evolution. The import function can or can't be used for that. No, unfortunately, it cannot be used for that. So again, I'm awfully sorry. I'm still having a lot of problem in trying to view the questions. Chrissy, can you see them? Okay, so it's neither Chrissy or. What I'll do, because I can't actually see your questions, is I will be able to pull a report with them all on, and I will come back to you individually. And I can see that there's a lot there, but unfortunately I can only see one line, and all the rest of them are hiding. So it's very, very difficult. And there just doesn't seem to be an option to expand them out so that I can see them. Okay, so I'm sorry, I apologize for that. It just doesn't seem to be working. So I will, as I said, I will view all your questions. I'll run a report and view all your questions, and I will send them the answers all to you. And we will display the answers to the questions on Insight as well. So please, I will leave the GoToWebinar session open for another 5-10 minutes. So please feel free to keep asking questions. And as I said, I'm just unfortunate that I can't see them. Okay, so I will close the webinar now. We have quite a list of questions, so I've just pulled through the question log, and as your email that you use to register is beside your question, so I will send you the answers later on this afternoon or over the next couple of days. If they take a wee bit of thinking about, it may be a little bit longer before I'm able to answer them. So, but we will definitely come back to you. Thank you very much for coming to today's webinar, and we'll look forward to seeing you at the next one.